So our next history that's come on recall important. That is 1 month old child. She is Sarah, and you are talking with Sarah's mother Salma. The problem is that Salma is telling some suddenly her child go blue color, and that's why hold her respiration and become blue. 1 month old child Sarah. So you have to take the focus history from the mother Salma. Okay. Hello, Dr. Nadim. Hello.
So
Mm.
yes.
So Sarah become blue 1 month of age. You need to take
mm,
the focus history from mother.
okay. Good morning.
Okay. Good morning.
Yes, I am Dr. Nadeem, one of the doctor in clinic today. I
Mm.
assume you are Sarah's mama.
Yes.
Yes. How are you doing?
Yeah, I'm fine. Thank you.
How can I help you, Miss? What should I address you?
Yeah, I'm Salma, Sarah's
Salma.
mom.
Sure.
Oh, the
How can I
problem
help you
is that
today?
my baby, my lovely baby Sarah, she's just only 1 month. What I noticed, she becomes suddenly blue. That's why I'm here.
Sorry to hear that. Could you please? You witnessed that incident,
Yeah, yeah,
did
I
you?
care my child. I've seen my
Sure.
own eye.
Sure. So, could you please explain for me? Do you have any video recording of that?
No, I can't record the video, but next time I'll record the video.
Sure. So, could you please elaborate what happened to her?
Yeah, she becomes blue. Sudden, I feel that she hold her respirations and she becomes blue. That is.
So,
Like,
when you said she became blue, so what
mm.
she was doing at that time? Was she taking milk or she was lying down or
Yeah,
in
yeah,
the
you
lap?
are you are asking a question. See, that is also I noticed that after meal, yeah, if she's taking the meal, she become blue.
After, is it not the first time that she turned blue?
No, this is the second time.
Second time, sure. When it was the first time?
First time 1 week back.
So, what happened? Did you seek any medical advice at that time?
Yeah, no, no. First time I don't know. I just hold her, and a few seconds later she become okay. But this is second time occur. I'm really scared with her
Yes.
these conditions, and I am here.
So we are here to help you too. Don't worry at the moment. And could you please tell me that this blueness was it around the face or on her limbs? Where exactly this blueness was?
Her face, I think.
Only on the face, around the lips, or around
Hmm.
the mouth. Where exactly? Or whole face?
Yeah, whole face, I think.
Did you notice any, stiffness or any limpness on the body? I mean, weakness
Yeah,
on the
one
body
thing
or
I want to
hardness of
mention you, I feel like she's arching. She's like arching her body.
arching her body. And
Mm.
what about her eyes? Did you notice any, her eyes went up or towards the side? Can you
No,
recall?
no, actually, it was a few seconds. I don't notice like that.
Okay. And what did you did for that? It was self-settled or did you give anything?
No, I just asking her, hello, hello, Sarah, what are you doing? What are you doing? Then I think she become okay.
Sure. And so it lasts for less than a minute.
Yeah, yeah.
Okay. And you said that it was about a week back it happened, right? And you didn't seek
Hmm?
any medical advice. Am I right,
No, no.
Salma?
Yes, yes.
Yeah,
He's
sure.
only two,
So,
1 month. I have not asked any medical advice.
sure. And what about, did you notice any fever in this? When she has fever,
No,
did she has cough, runny nose, blocked nose,
nothing.
and vomiting?
Yeah, yeah. She has thrown up.
And Ms. Salma, could you please, if I ask you to explain this thrown up, what do you mean by that?
Vomiting just only, the food content is past what I given. She just drink milk, and I think the food content is coming with the vomiting.
Okay, does it come from the side of the mouth or it goes away from the mouth?
No, no, just side of the mouth, not goes away
Side.
from the mouth.
And what comes mostly is only the curd like milk, or does it have anything else?
No, no, only milk.
Sure. And could you please tell me that does she have any, did you notice any, that her tummy is getting bigger?
No, I don't
Eh,
notice anything.
Did you notice that she has, passing difficulty in passing urine or poo?
No,
Did you notice any rashes on her body?
no.
Sure. And you said your child is 1 month old. So has
Mm.
she ever, in this 1 month, does she has ever admitted?
No, she has never admitted. Just after
Okay.
delivery, we go home.
And could you please share about, your pregnancy? Did you seek medical advice when you were pregnant with her?
Yeah, I have medical advice I have taken. I was on the follow up.
And what about her, mode of delivery? Was it a normal delivery or through operation?
It is a normal delivery. She delivered by vagina.
Okay, and what was her body weight?
I think she is 2.3 kg.
2.3. And what day of life you went home?
Yeah, the next day we go home.
Sure. And we usually do certain, investigation on a child that is called screening test. Have they done so far?
Yeah, yeah, everything doctor done.
Okay, so how many kids you have?
Yeah, this is my second child.
How's your first baby?
Yeah, she's okay. I have no any concern.
Sure. And what are you feeding Sarah with? Are you
Mm,
giving
only breast milk.
only breastfeeding and only on demand?
Yeah,
Okay. And what was her birth weight?
I told you repeated question 2.5 kg.
2.3. No. And today?
Today I have not measured. You
Okay,
guys
sure.
measured.
Sure. And one in your family has any, problem? Her father or your other sibling? Any illness?
No.
Sure. And what is your job?
Yeah, I'm a teacher.
Okay, sure. And what about her father?
Father is also teacher.
Okay. Are you giving anything else other than the breastfeed? I mean, any, home medication, home remedy, or anything else?
No, I just come here for your help.
Sure. So, do you want to tell me anything else which I didn't ask? Later on,
No.
it will be helpful for you. Sure.
Yeah.
So, okay. So, did you notice any, the last question before we move on? Did you notice any, joints getting stiff or limp? I asked you
No.
earlier also if you didn't
No.
notice. Sure. Okay. Thank you, Miss Salma. Thank you.
Okay,
So,
thank you for the history. You completed it on 9 minutes. 4 minutes remain. You have missed lots of things, also disorganized. When
did
you analyze the present history, you on the present. On the past, you just complete the past. Then
mm,
sudden you go for diet history. Sudden you are going family history. In family history again you are doing other than breastfeeding. Have you given anything? So you need to like when I go diet history, I need to do all the diet questions. When I go family, I will family related all the questions. Some questions when we take the history, some questions. So what is the diagnosis in this patient?
this
Hello.
patient, yes, I would said, GERD, gastroesophageal reflux, and
Mm-hmm.
overfeeding.
Mm,
And there is arching. It could be, I need to look for. It could be Sandifer syndrome.
mm, mm.
These three.
Okay.
But cyanotic heart disease cannot be ruled out because this is the second episode. So we need to get the proper history examination, oxygen later on management. What I missed in the history, please mention, Miss Emma.
Yeah, of course I am mentioning. So you are telling 3DD, overfeeding, gastrointestinal reflux, and Sandifer. Which one is fast?
With arching episode, the Sandifer would
Yes,
be first
Sandifer is
one.
on our top diagnosis. Yes, top is Sandifer. So you need to first tell the Sandifer. Then the
Yeah.
overfeeding. Is that overfeeding, mother? Are you feeding frequently? How many times you have given? Do you ask how frequently the child is feeding the breast milk?
Yeah,
You
yeah,
need to
she
ask
said on
how
demand.
many milk on demand. So, okay, on demand, what is on demand? You on demand, you tell me, not I told that, doctor, I'm giving on demand. Okay. So you need to ask, like you need to search 2 or 3 questions. Examiner need to know that you are searching overfeeding. Okay. Examiner doesn't know. You need to know that I know what is overfeeding. I know what is gastroesophageal reflux disease and Sandifer syndrome. So normally this is a child. The task is that 1 month old with bluish discoloration related to the meals come today the second attack and told that the first attack was 1 week ago. So,
Mhm.
as usual, onset course in durations, how it started, how long he suffers, before what is happening, after what is happening, during what you do. Is it first time occur or recurrent occur? Okay. So I told you this is second time occur. What happened before, after, during? I will tell that association. Is it associated with anything? Like associated with vomiting, I told you, and also feeding. So feeding, okay. After feeding, without feeding, you know that if vomiting, you need to exclude the vomiting, like vomiting onset course in duration, morning vomiting, the color of the vomiting you need to ask me. Also one thing you importantly ask, that projectile vomiting or not, is that vomit go to near or the far away. For hypertrophic pyloric stenosis we need to rule out in this age. Did he vomit everything? Is it stony? Is it the vomiting after feeding? Any cough during vomiting, the child is any cough, because hernia something also work on child. So vomiting is associations and meal is association, always associated with the meal. Any other concern, any chronic condition the child is suffering or not? Ask. Then we got the fever, weight, activity, and sleep. How about any fever? What about the baby's weight? He's gaining weight properly, do you think? Or you have any concern about weight? Then I will tell them, no, my baby is not gaining weight, doctor. Okay. And how about activity? The child is active or not? Sleep pattern. Mm, Okay. Then we go the systemic review. Systemic review, CNS, any abnormal movement. Yes, that is an arching back, the child. Serial by serial, loss of any consciousness. What about his hearing? What about his vision? What about his excessive any salivation present or not? Um, okay, recurrent ear infection, CVS, any racing of the heart. Do you notice when you handling the baby? Is there any racing of the heart? Uh, yes, congenital heart disease, one of the DD in this case you are telling. Respiratory, any chest infections. GIT, however, tummy size, any tummy pain, tummy swelling. You ask the tummy size increase or not. Yes, any tummy swelling. What about the pee? What about the poo? Don't you ask me? Any MSK, any skin spot, any joint pain, anything. These are the routine question. Any history, endocrine in this child, we can't ask because that is neonate screening. It will go. Okay, then we got the past history. There is no any puberty history. So past history 5T IOA, that is very easy. Any trauma, any treatment the baby is taking or not, any blood transfusion occur or not, any surgery occur or not, any team the child is occur or not. If there any positive past history you got, then any investigation, any admissions, these are. So this child has no any remarkable past history, I told you. But you have not asked any trauma, any treatment, traveling history. Then birth history, you ask nicely. Is there describe the birth? Here it is in 1 month old baby, so we take the birth history um, elaborately, because this history is a short history. It is an acute history. Nothing. You need to cover the 13 minutes. There is no puberty history, no any heads history. So birth history, you will take the details, how the mood of delivery, mother taken all the medication properly or not, screening test or the not, when pass the fast poo, yeah, is that the baby cry after birth, after the discharge occur or not, everything you need to ask. Then vaccination, don't you ask me vaccination, right? Then allergy you have not asked. Nutrition, diet history here, what type of food he's taking. Is that only the breast milk or other any food? So that is breast milk. How many times the baby is taking? What is the amount of feeding? These are we need to ask, because gastroesophageal reflux disease is one of our DD. We need to target. Development you have not asked. 1 month old baby. Then family social psychological. How many? Describe your family for me. How many people living here together? other people has any similar condition, any long-term medical condition or not. This baby has no any school, nothing. So the how this disease affect you and financially, what you do for living and that is. So this is about Sandifer syndrome. Sandifer syndrome is very important in video stations. We know that.
Yes, you're right. It can
Mm.
come in video and long case both.
So Sandifer syndrome usually occur age 18 to 24 months, and the DD can be gastroesophageal reflux disease, hiatus hernia, infantile spasm, new type of any seizure, non-compliance to of the previous seizure, pain from the stiffness, straining from constipations. So you asked me about poo condition because straining from constipation it can be occur. Recurrent aspirations, cow's milk protein allergy, diet only breast milk, I told you, but cow's milk you also ask. When you ask that, are you given any cow's milk? Then the examiner will know she on her mind cow's milk also. Acute dystonia, meningitis, encephalitis, and metabolic. These are the cause. Then history, onset course and duration, what increase and what decrease, relation of the feeding, association with vomiting, the vomit is projectile nature or not, is he well thriving, what about the weight and the centile, type of feeding, if breastfeeding or artificial, what about the weaning, repeated any chest infection, recurrent ear infection, excessive salivation, any blood in the stool. So any poo, you can ask about the blood in the stool also. History of any allergy or eczema, any developmental problem for CP, cerebral palsy, cerebral palsy associated with vomiting, any chronic condition, history of any drug intake, history of any operations in early life, for diaphragmatic hernia and esophageal atresia. So this is very important, diaphragmatic hernia and esophageal atresia and perinatal history. So this patient come, I will examine first, then I will investigate, then I will give the how can I manage. I will examine the ABC, airway, breathing, and circulation vitals. I will check the hydration status of the child. Here, what we will check the anterior fontanelle, skin turgor, urine output, capillary fill time. Then take a weight and height and plot them on the appropriate growth chart. General examination for the any skin, like tuberous sclerosis and neurofibromatosis, because Caesar is also our DD. Neurological examination and chest and abdominal examinations. In unit examination, we will tell that. That is 1 month old child. Investigations, 24-hour pH study, 24 pH and impedance study. So pH study do they detect the acid reflux episodes only. 24-hour pH and impedance study detect both acid and non-acid reflux episodes. Upper gastrointestinal contrast or barium swallow, Bridio fluoroscopic swallowing study. That is not needed for Sandifer syndrome. I will involve my consultant, then I will do the investigations. Management actually, after assessing the general condition and hydration status of the child, discuss with the consultant if in need admissions. So I will consult my consultant that admission needed or not. The non-pharmacological treatment are the child will be eat on upright posture, review the feeding history, reduce the feed volume. If excessive for current weight, small and frequent feed we will give. Overfeeding, so small and frequent feeding we are giving. Trial of thickened formula. There is no trial, the child is breastfeeding. And family history of atopy and presence of eczema, pain on feeding. If consider trial of extensive hydrolyzed formula for 4 weeks, consider amino acid formula if partial response or relapse after response. If breastfeed, trial of cow's milk exclusion from the mother's diet for 2 weeks minimum. Obese child, weight management, healthy lifestyle choices. What is the pharmacological treatment? Treats symptoms but does not reduce the number of acid reflux. If it is not upright posture, small and frequent feeding, all this non-pharmacological management is not improving, we can give the pharmacological treatment like trial of L-Genate, Gaviscon therapy for 2 weeks. H2 receptor antagonist that is ranitidine, easy to administer for 4 weeks, and proton pump inhibitor we can give for 4 weeks like omeprazole, lansoprazole, esomeprazole. Refer if no response to the treatment, recurrence on stopping treatment, but will never give domperidone. Remember, domperidone is no longer recommended for children aged below 12 years. Surgical treatment in refractory parents is Nissen fundoplication or jejunostomy. What is the treatment I involve? Consultant pediatrician, gastroenterologist, neurologist, dietitian, and salt, speech and language therapist. Okay, this is all about Sandifer syndrome. It come like as an abnormal movement. A 1 month
Yep.
old child come with abnormal movement. So any movement, anything, onset, course, duration, what before happened, during, after, associations. Is that associated with anything? Feeding, then we'll go the association. Then any chronic conditions, then fever, weight, activity, sleep, then the systemic review, the structure, CNS, CVS, respiratory, all the MSK, endocrine, I will ask. Then go the past history, 5T IOA, then the nutritional history. If child 14-year, we go the puberty history, birth history, allergy, vaccination, development, and family social psychological. This is the the technique of history taking. Okay. Thank you for this history.
Thank you.